Good afternoon, everyone. My name is Asad Choudhry. I'm a surgical resident at SUNY Upstate University Hospital. Before I start, I wanted to thank the association for granting me the privilege of the podium to present our topic of research, really looking into a review of malpractice in hernia surgery and identifying how damage to surrounding structures continues to remain the most common reason for litigation. Myself and my authors have nothing to disclose related to this talk. To start off, abdominal wall hernias, in terms of hernias themselves, they're the second most common abdominal pelvic procedure performed in the United States after the C-section. More than 1 million repairs are performed annually in the United States, and this is increasing that we've seen over time, with an increased trend towards a minimally invasive surgical approach using laparoscopic as well as robotic surgery as a means to increase the number of procedures and allowing them to be performed safely. Now, though this is a relatively safe procedure, complications do occur. And when they do occur, patients may often seek legal redress. Here are just some of the headlines that you will see out there in terms of litigation related to hernia surgery throughout the United States itself. It really shows kind of how varied and how large the payouts can be across the US, regardless of the state that you are practicing in. In terms of US medical malpractice payouts, since the 1980s, they have started to decline, though there was an inflection point at 2012 where now we are starting to see an increase at award payouts for the plaintiff itself. So perhaps last year you saw that there was close to $3.8 billion paid out to consumers as well as plaintiffs in such cases. This continues to grow. In terms of the proportion of physicians facing a malpractice claim annually, you'll see that 15% of general surgeons will be facing some form of malpractice claim annually across the United States. Physicians in high legal risk specialties, such as the surgical specialties, are 99% likely to face a claim over their career. Over the course of their practicing period, nearly 11% of physicians will have an open malpractice claim that is unresolved. In terms of payment amounts for malpractice allegations itself, you can see that surgery continues to be the second leading cause of malpractice award payouts just after diagnosis, accounting for nearly a quarter of all annual payouts in the United States themselves. And hence, the aim of this study was to understand litigation in the setting of abdominal pelvic hernia operations. And the way we did this was using Westlaw Next. Westlaw Next is an open legal public database that collects law cases from all jurisdictions throughout the United States. This includes both federal as well as state level cases. We looked at all cases where there was mention of a hernia operation, including the abdominal pelvic region. Cases where the hernia surgery was not the primary reason for litigation or as a result of something else were excluded. In terms of what we looked at in these cases, we looked at the setting of litigation, why it occurred, the case characteristics, the allegation or the lawsuit itself, and then the outcomes of the case lawsuit. In terms of our results, we noted that the average patient plaintiff age was 45 years with a standard deviation of 18%. Nearly 95% of cases were litigated for adult patients, with only 5% for minors under the age of 18, where a hernia operation was performed. In terms of sex itself, males were predominant. 65% of the plaintiffs in such cases were male patients. Overall, in terms of the hernia itself, inguinal hernia operations were found to be the most common hernia procedure that led to pursuance of litigation. And it was laparoscopic surgery that was the most common procedure rather than open in terms of patients pursuing litigation. In terms of our results itself, we noted that informed consent was breached in 48% of cases. In terms of the type of repair itself, elective operations were more common, and mesh was used in approximately 27% of cases where there was a defendant verdict and 18% of cases where there was a plaintiff verdict. And now in terms of the defendant specialty itself, we found that general surgeons were the most common surgeons named in these lawsuits, and that was statistically significant. In addition, cases where there was no mortality were in favor of having an outcome for the defendant surgeon themselves. Now I think this slide is probably one of the most important slides because it looks at the alleged reasons for litigation based off time period, and we divided it based off preoperative, intraoperative, and postoperative period. In the preoperative time setting, delay or failure to diagnose or manage a hernia, and these cases were mostly emergent patients presenting to the emergency department where an intervention was not performed in a timely manner leading to some form of complication, was the most common reason for litigation. Overall, when we look at our study, damage to surrounding structures within the intraoperative time period, which included nerves, included additional abdominal organs such as the bladder, bowel, etc., were the most common cause of litigation overall in the intraoperative and looking throughout the study itself. In the postoperative time period, failure to timely detect and or repair a complication resulting directly from the surgery itself was the most common cause of litigation in comparison to other reasons. However, it is important to note that persistent pain, such as nerve entrapment syndrome, is also noted in the postoperative time period as a cause of litigation. When we look at the National Association of Insurance Companies' classification of how severe the injury was itself, we note that most of the claims where there was an insignificant or minor injury were for the defendant verdict themselves. As you start moving onwards and when you climb towards death, you see that most cases were for the plaintiff itself. And that's correlative because patients tend to sue more when there is a larger complication such as a death of a family member or an individual. This was an interesting finding that we noted in our study. So when we looked at hernia lawsuits reported per state population, we noted that specific states such as California, New York, Texas, Florida were found to have the highest number of lawsuits per state population. And this was correlative with the number of lawyers also practicing within that state. This right here on this side shows the total number of malpractice payouts, which is correlative, showing that states which are more likely to have malpractice claims filed are also the states where the most common hernia surgeries being performed are likely if a complication occurs leading to litigation. This was an interesting finding as well. When we saw lawyers or states where there were more lawyers practicing had more cases filed per state for hernia litigation. And this included at the top states such as New York, as well as California, Florida, and Texas going down. In terms of our limitations for Westlaw itself, there is a limited amount of medical information, hence we were not able to look at total malpractice claims. The sample size case is small compared to the total number of malpractice hernia cases filed over this time period. And Westlaw does not allow specific patient information that other malpractice insurance companies may have. And then finally, we were not able to account for tort reform that is changing over time and continues to change at the state level, which may affect the results. In conclusion, we noted that damage to surrounding structures was the most common cause of litigation. Most cases had an outcome in favor of the defendant physician themselves. However, those in favor of the plaintiff were found to have costly award payouts. Understanding errors and identifying future prevention strategies as well as overall tort reform may mitigate future risk of litigation related to hernia abdominal pelvic procedures. Thank you. I'm happy to take any questions.